So we'll just get started then. I'd just like to welcome everyone to the 8th Mates for Kids Community of Practice meeting. We're very grateful to everyone who's been part of the journey so far. This is our last meeting for 2024. We had our most recent one in August, and we had the UN Science Summit in September. It's been an incredibly busy year. Dr. Aisha was with us at the World Health Assembly in May in Geneva. We had SIDS4, CSW, CSD. I think we were all exhausted by the end of 2024, but it's been worth it. And in particular, we've been excited about the grants. It's a real honour for CLAN. This has been our 20th year as an NGO this year, and we're really proud to be committing to our big, hairy, audacious goal of reducing mortality associated with CAH by 30% by 2030 in partnership with everyone around the world. And in particular, our goal of giving out 40 grants by 2030. So I'll just briefly acknowledge that CLAN is headquartered on the lands of the Wallumattagal people of the Eora Nation in Sydney, Australia, and we pay our respects to the traditional owners of the lands that we are honoured to work on and live on. We also acknowledge the amazing elders and champions and leaders around the world that we have the privilege to work with as well. I'm just going to briefly, I just have a quick 10 minutes. I'm just going to recap Mates for Kids, what it is we're trying to do, how we think that we're going to achieve it, how we feel that we're tracking at the moment, and next steps as well. So everyone would remember the briefing paper we shared with WHO in 2022. We were spurred to action when Zimbabwe reached out with challenges with access to medicine, and we'd seen what was possible in Vietnam. And we didn't want to just go step by step anymore. We wanted to do something really dramatic. So we committed to reducing the preventable mortality associated with CAH by 30% by 2030. We proposed to do this with 3 key objectives: improving access to essential medicines and equipment for the CAH community, strengthening CAH communities around the world, and we have a lot of experience with CLAN's strategic framework for action, helping communities and their allies to enact that, but also really promoting the scaling of newborn screening internationally. And of course, 28th of June is International Neonatal Screening Day, and we're really excited to connect with so many people who are leaders in that space. Why do we think it's possible? Well, because we've seen it happen. Vietnam, back in 2004, when CLAN started working with them, this was the mortality part. This was the demographic profile of the CAH community. Quite a lot of babies with CAH, but no one really making it into older age. It reflected enormous mortality, and we could see the suffering. We also knew that it was really only the wealthy families who were surviving compared to the rural poor average income. The average income of families in Vietnam was very high. As at 2017, the number of children who are diagnosed with CAH who die is minuscule. So Vietnam has done it. We know that it can be achieved. So now we just want other countries to achieve this as well. We're going to use some underlying frameworks. I've referenced CLAN's strategic framework for action, our 5 pillars, and our focus on improving quality of life through community development. We're also using the knowledge to action framework, first published by Graham et al. In 2006. It has a real focus on identifying...
No, aquí no es votación, no es si la señora está de acuerdo. Así lo manejamos.
We're really focused on identifying local priorities and solutions, enacting them, using data to track how we're progressing. And the Mates for Kids toolkit is this synthesis of tools and resources that comes about, and we all build on it together. The WHO's 6 building blocks for health system strengthening is really key to what we do as well. It really highlights the importance of holistic systems-based approaches. And we launched a paper at the UN Science Summit earlier this year outlining our approach. And we really are aligning as much as we can with the childhood cancer movement, who are doing some fantastic work. And I just acknowledged Dr. Catherine Lamb, who helped us, gave us permission to adapt her framework there. And finally, the Mates for Kids strategic framework, which really puts the CAH community at the centre of all of our actions, gets as many different people and organisations involved within the community of practice. We focus on those 3 objectives and we come together around the world using key dates and events to share successes and stories. How are we going to use the SDGs and the timeline? How does that all relate? Well, all member states have committed to achieving the SDGs by 2030. SDG 3.2, particularly 3.2.1 and 3.2.2, and SDG 3.4 are very relevant to us. We've taken from SDG 3.4, which commits to reducing the preventable mortality associated with NCDs by 30% by 2030. Obviously, we've copied from that for CAH. And so we're really aligning with that, and we're leveraging UN events as we can. We've got quite a bit of time. We've got a full 5 years before 2030. We've already done so much in the few years that we've been going. So we feel it's possible. In terms of indicators and data and tracking, just to recap, so the World Bank acknowledges 192 different countries. When we break them down by region around the world, each region has a certain number of countries. So Africa has 47. And then we look at the countries that we really want to focus on. High-income countries, they don't see a lot of mortality with CAH. It's not so relevant to us. But within the African region, 46 countries are eligible for us to focus on as low, middle, or upper middle income countries. In the Americas, with 35 countries, there are 24 countries that fit that criteria. In the Eastern Mediterranean region, there are 15 countries that would be of specific focus and interest for us. In the European region, 20 countries. So the majority of countries are in high-income countries, but there are still a lot of countries where we could be working. In the Southeast Asian region of note, all countries fit into that criteria, and the Western Pacific region, there is another 16 countries. So when you add up all of those countries, there are 132 that fit into those criteria. And if you look at reducing mortality, 30%, what's 30% of 132? 40 countries. That's where we've got our goal of really driving change in 40 countries at a minimum. If we take a phased approach, 40 countries, and from an equity perspective, we really need to focus on Africa, the Southeast Asian region, and then sort of like scattering around elsewhere as well. Phase 1, phase 2, phase 3, taking us out to 2030. So phase 1 is where we're at the moment. We've already given out grants to 8 countries. We've given out 11 grants overall. Some countries have had 2 grants, and that's reflecting the fact we've had applications from the CAH community and the health professional community. But we are on track. We are on track with the number of grants we've given out so far. So here we are, phase 1. We're coming into the UN high-level meeting on NCDs next year in September. That'll take us into phase 2. And with this approach of increasing the number of grants out to then, we feel that we'll be able to do it. As I mentioned, we're already 20% of the way there to 40 countries. And this is a pie chart of the grants that have been distributed so far. And I really want to acknowledge the incredible work the grant recipients are doing. We'll be hearing from several grant recipients today. Colombia is not presenting today. They'll be presenting in the Americas, Africa, and European one, but we met with them recently. And the changes that they are driving in Colombia are truly extraordinary. And we'll hear amazing things from different champions today as well. So next step, continuing to work with CAH community members and allies, really being very clear on our strategic direction, the grants, the quarterly community practice meetings, using the indicators, and I'll speak about them a little bit later, building our toolkit, using the WHO's Knowledge Action Portal platform, leveraging UN events, working together, building on partnerships. We do have a calendar of events on the WHO CAP, and we encourage people to look at that. So that's it from me with this introduction, and I would like to now get started in our thematic section. I'm not sure that our colleagues, we have colleagues from, I'm not sure who's on at the moment, but Kath's reaching out to the team from from the Philippines, because they're going to be talking about their project. But I might hand over to Irene Mitchell-Hill, if that's okay. Irene has been working as a CAH nurse specialist in Australia for a lot of time. My son is now 25 and living a happy, healthy life with CAH, and I'm grateful to what Irene has done for our family, helping us live the best life with CAH that we can. So Irene has developed a really amazing resource, the CAHPePTalk. So Irene, I'm going to open up there now so you can press the share button and start sharing, and I'll hand over to you your presentation. Thanks, Irene.
Thank you. Let me just get it up now. We had a little practice run. Where is it? Yeah. Sorry, Kate.
No
Share.
problem. So press the share button and then just choose the screen. Yep,
Okay.
perfect.
All right.
And just enlarge your screen. Press that green button again.
This one? No, this one. Sorry, I've gone over again. Hopeless.
You're right.
Yeah. That one?
Yep.
No, gosh, no.
Oh, that's right, Irene. And now just press on. Yes, you're right. Off you go. Perfect.
I'm in full screen. Okay, all right. Okay, look, lovely to meet everybody. This is my first time I've been on Mates for Kids, even though I've heard quite a lot about Mates for Kids. I'll just put this this up here. This is my website that I'm on, and I've got the share link to it. This is my profile, which will actually give you a lot of information about who I am and what I've done over the years. And I've been working with CAH patients now for probably 40 years, I suppose. So over that time, I've found that I needed to develop educational programs for the patients that I was looking after with CAH, because I felt that there was a void in the system. So thank you for your interest in this pep talk. It's called CAHPePTalk, which actually has 5 chapters of video presentations that have been done by the medical staff that I've worked with over the years. So it's quite intensive, but the priority ones I think that we need to focus on, it's a very comprehensive program. But the chapters that are absolutely excellent are chapter 1, which is what is CAH, which is very clear and concise description about CAH with overview and diagrams. Then there are 2 further chapters, chapter 2, chapter 3, which is adolescent and adult issues and psychological issues. They pertain to that particular population of the CAH community. I have purposely not gone down the track of dealing with the ambiguous genitalia issue on this particular platform. I feel that in the families that I've managed CAH with over the years, I find my interpretation is that anything to do with gender for these children is a personal issue, and to actually have that discussed out on the public platform is not where I think it's not important for a global presentation. I think it's very, very individual for each individual family, and every individual family will interpret the ambiguity and the gender issues to their own need. The next 2, and this probably the next 2 sections are sick day care and emergency hydrocortisone. These are where I think we need to focus primarily in the theme of what we're trying to prevent over the years, which is reduction of mortality and morbidity as well. I mean, we don't, if we can prevent these children having poor outcomes over the years by providing what needs to happen when they need to have when they become unwell, and how to give their child an injection of hydrocortisone. So that's where I have focused that particular these particular chapters. This was actually part of what I developed as my Master of Nursing thesis. It also has a patient evaluation. So if you ever run any of these programs, you can actually evaluate what the community that you're delivering the education program to, or the information to, what their knowledge is around CAH. So it's a validated questionnaire. on how to actually just to assess patient knowledge. There's a very comprehensive list of things that I have under adrenal insufficiency, because adrenal insufficiency is the primary issue. It pertains to those with CAH, but also those with pituitary adrenal insufficiency. So there are 2 or 3 categories under that as well. So there are lots of resources in here and their guidelines as to how to identify someone who's having a sick day episode, what to do. And so we have actually started to translate some of this information, and we have actually done this already for Indonesia and Pakistan. And we have completed the Urdu. We did this some time back, but we are in the process of actually now progressing that into video format. So we've got verbal and transcript and slide presentations to put together for that Urdu community. We've also done a little bit with Tagalog, which is for the Philippines. Again, that needs to be reviewed by the medical teams to ensure that they have, that the information we're actually translating is correct. The big thing that I've focused on this year is my adrenal insufficiency for schools. And this is where Kate has had lots of requests for this to be translated into other languages. It's a very concise, it's a 9-minute video on what is adrenal insufficiency and how you manage that, how the teachers should identify a sick child and what they should do. Basically, it's the same amount of information that a family should understand about identifying when their child's really sick and what they should actually do. So it's quite comprehensive. It's in a graphic format, and we haven't had that translated yet, but certainly I'm very keen. I've got the transcript for this to be translated, and then what we do is we actually do transcript on the slide view as well. We keep the English translation and the translation underneath for the foreign language, so we can actually track what the actual video is saying and what direction it's taking the information in. The other one is there's actually a hydrocortisone injection video, which was done again. It's been around a few years now, but it's certainly very handy. And what's really good about this, and I'm not sure if it'll come up. No, okay. All right. This is the front end of the video for the hydrocortisone injection. The issue I have with hydrocortisone injections is that there are different types of hydrocortisone. So in Australia, we have something called an active vial. In other countries, such as Vietnam, they actually have a single vial and water. And we are trying to streamline the development of hydrocortisone into a EpiPen style injection, but the cost is prohibitive. So the companies tend to steer away from that. They're not quite keen to spend a lot of money because they don't think the market's big enough. So they're the main ones that I would like to concentrate on getting translated. I think this is what I want, the video link. No, sorry. It must be in here. There is what's called an SMS card. So this is a card that's been developed to, we just updated this the other day, and I'm struggling to find out where I've put things. I think this might be it. This is it. So what we have, this is a pocket card. So this is for families to be able to get immediate access to the video that I showed you. And so they can actually text Solucortef to this telephone number, and they actually are able to get the information about how to give a hydrocortisone step by step when they're there with their injection pack in front of them. I know Kate's been talking about trying to improve access to injectable hydrocortisone in developing countries. That is something I'd like to see happen. But again, it's all to do with resources, concept of people having to give an injection. So quite often there is a bit of a negative around families having to inject their child, and we find that in Australia as well. But I've found that I always make my families practice, and they practice on the parents practice on themselves to know what it's like to put an injection in somebody. And that's just with saline. So practice is really important. But it's also important for identifying when these children need to go to hospital and how far they are from a medical centre to actually get help if their child is sick. So trying to focus the education around that information is where I'm trying to focus anything that has a link into the pep talk that I would be looking at translating would be the important information that is life-saving for these children. So that's probably the main information. I think that you know, life-saving information for those in the developing countries, I think is really, really important. There's other information about how you manage sick day care, understanding what happens with children who, why they get sick, that they can't produce cortisone, so therefore it's a life-saving medication. If they don't have it, they can die. And it's also managing the fact that quite often these children do not get adequate treatment. So getting adequate treatment to suppress adrenal androgens in the CAH group is incredibly important. But I understand that around the world there are problems with access to medicines, and that's where CLAN's been amazing in trying to make people aware of why it's important to have this medication and how to manage sick days so these children don't have poor outcomes as adolescents, where they have excess androgen that drives their weight gain and infertility issues as a young adult. So there are things I'd like to sort of build into this pep talk program, but I would like to translate anything that's critical information as a priority for this group of communities around the world. Anything else, Kate?
That's brilliant. Thank you, Irene. Can I just ask, if someone was interested in having something translated, so for example, your school's video into Spanish or any of these injection resources into local languages, what should they do? How should they approach you? What do they need to do?
They can email me, and the link should be on the back of the Pep Talk website. If not, they can contact through you, of course. I have a New South Wales health website, health email. I would then supply them with the transcript of the narration and the transcript of the bullet points on the slides, and we would just overlay them on top of the current video that exists, which I said was 9 minutes. And it is the one that's probably the most critical one, because it's got really, really concise information about what to do when your child gets sick. So the sick day, as far as life-saving information goes, that's the one. The actual other information about understanding the ins and outs of CAH, it's another area of importance to focus on down the track. But getting priority is number one, getting plenty of medicine. But so if anyone wants to contact me and offer me the translation, I will send them the transcript. We then get it vetted by a medical person to make sure that someone from their country to make sure that the translation's correct. And then we just overlay the English translation with the foreign language translation.
Thank you, Irene. I think that's been a key, hasn't it, in the work we've done together so far, is having the local Paediatric Endocrinology Society endorse the translation.
Absolutely.
Yeah, so that's been
Absolutely.
Thank you.
Yeah, this SMS at the moment is only on an Australian platform. I was overseas recently. I never tried to access it, and I should have. So I put a +61 in the front of it, but I'm not sure if you can. You should be able to access it from overseas, I would hope. But it all depends on the type of hydrocortisone someone else has. But if anybody's interested to see, in the 2 translations I've done for Vietnam and Indonesia, there are 2 step-by-step leaflets that have got the translation in the languages for a vial and water. So we are able to do the translation for both types of preparation.
Lovely. Thank you so much, Irene. And Irene, I might just ask you to put your email address and the CAHPePTalk link in the chat, if that's okay, for anyone who wants to reach out to you. And perhaps also that +61 number, and maybe someone online might be able to.
Right.
And Dr. Raul has offered to collaborate with Spanish translation, and in fact, he's responsible for the Sue and Rivki's Spanish booklet, the Sue and Rivki's book in Spanish, and he's the most senior ped endo in Mexico. So That's an
Just while
amazing-
I'm on that too, I mean, Shubha might even talk to this. The ANSPED website, which is the Australian and New Zealand Society for Paediatric Endocrinology and Diabetes, has a full link of translated endocrine documents.
Right.
If anybody's looking for translations, that might be helpful. I had a quick look at it, but it's certainly there. And yeah, certainly. But I know I spoke to someone ages ago from Mexico or somewhere, I think, about doing translations. That was that was 2000 and I don't know.
So Irene, if you can put the ANSPED link in the chat as well for people to access, that'd be great.
Where do I chat?
There's a chat thing down the bottom near the green arrow for share. All right. Well, thank you, Irene. Perfect. Right on the dot. We have our next speaker. The team from the Philippines is hopefully joining us a little bit later. But I'd just like to introduce Dr. or I think she might be a Professor Aisha Khan, a newborn screening expert from Pakistan who is an executive member of the International Neonatal Screening Society and a true leader globally in the field of newborn screening. Irene, if you just end share, press that red button, end share. Thank you. And Dr. Aisha, Professor Aisha, we'd love to hand over to you now. And thank you for speaking on newborn screening for us.
So thank you, Kate, for inviting me and talking on this important subject. And I will, as you suggested, I will update you on global newborn screening activities and the status in Pakistan. And I have nothing to disclose. And here is an outline of my talk. And there's so much going on globally on newborn screening recently that it is very difficult to consolidate it in one 15-minute presentation. So what I will focus on, that I will tell you about the approach that the Global Task Force of International Society for Newborn Screening and International Federation of Clinical Chemistry has taken, and will update you on the status on partner countries and their progress that the Task Force Committee has so far made. And then I will update you on the status of newborn screening in Pakistan. And there is also so much going on at individual levels and at some of the institutional levels. But what I will be focusing in this presentation is on activities of a group, working group, PAK IMD-NET, which was conceived under Pakistan Society of Chemical Pathology and at Al Khan University. And then I will also update you on the newborn screening at Al Khan University Academic Medical Center, because this is the program that is, following all the norms and the criteria and the way forward from all the three, PSCP, PAG IMD-NET, and AKU Medical College. So regarding the Joint Task Force on Global Newborn Screening, it was conceived and started in 2021. And I was appointed co-chair along with Jim Bunham from ISNS as an IFCC representative. And the objective or the overall goal of this is to help develop appropriate newborn screening programs worldwide, and especially in LMICs. And it's not like providing funding to develop newborn screening program, but through support networking and information exchange activities. And how that we are approaching this area is that initially we engaged and raised awareness through the member societies of the IFCC network and its federation, and the members within the ISNS, and engaged and performed a need assessment survey, and through that survey we engaged local advocates and key national health policy makers. And now the group developed, helping them, supporting them through their local advocates for developing strategies and, crafting solutions for newborn screening. And we plan and we conduct pilot activities in countries where newborn screening is not available. world, and we facilitate sustainable nationally funded programs to a member in the the society which is affiliated with IFCC. So, and at the same time, we are monitoring and evaluating the performance through face-to-face meeting or in-person meetings. And these meetings are supported by IFCC. And then there's a follow-up in the task force meetings. So and since then, we have contacted and supported several, countries. This is the list here. And in-country meetings have been held in South Africa, Dominican Republic, Romania, Kazakhstan, Bulgaria, and Nigeria. And this is the progress with which Dominican Republic has made. Dr. Van and Marta is the task force member who is coordinating with Marta Ascura. And Dr. Van, principally representing task force, supported and revitalizes local contacts and assesses the situation at the ground level. So what happened that after the first face-to-face meeting in February, I think it was in 2023, that Dominican Republic was able to perform the legislation on newborn screening. And now there is an interest in screening for hemoglobinopathies first, which is an initiative of the current First Lady in Dominican Republic, and the society is engaged and progressing through their annual congresses, which was supposed to held in November end. And the building that you see is under construction, and this building will house the newborn screening lab in Dominican Republic. So, and Dr. Van is continuously following with them. Then in South Africa, there was the first, after the face-to-face meeting, a proposal to establish a national advisory panel for biochemical NBS was proposed. And now there is a group, South African newborn screening group, which is in engagement with the Provincial Department of Health, has several plans for piloting newborn screening in Limpopo. And a newborn screening committee has been established by African Federation of Clinical Chemistry. There is establishment of an independent rare disease advisory board, which is underway. And they are, members, some are also participating in WHO NBS framework consultation with the global experts. So, because, you can realize that newborn screening is not a one-time event, and it's not easy to, offering a test, it's not, and it has to be in a pragmatic way. So that's how, and the countries are at a different level and various different levels of, achieving this target. So in Kazakhstan, task force had a meeting, and there several other groups also joined, including ADLM. And so far in Kazakhstan, neonatal screening is mandatory for PKU and congenital hypothyroidism. And their goal is to expand the program to include screening by tandem mass spectrometry. And there was a workshop where Diane and Jim Bonham participated, and the aim of the workshop was to help define a pathway towards reaching the goal of expanded newborn screening. And work is still continued on after the workshop via Zoom meetings. And you can see that Diane is collaborating with Kazakhstan. Then in Nigeria, John Annett of the task force has initiated activities, and you can see that there are several CME seminars, participation in the National Newborn Screening Day, etc., have been taken by John. And now, last month, November, there was a meeting where many speakers from task force, United States, UK, APHL, WHO participated. And the outcome was that a consortium for newborn screening in Nigeria has been set up. And now this will be taken forward. And the face-to-face meeting was held in support with IFCC, and Professor Rajiv Erasmus is also, very active in this region. And this again, so is a snapshot of the activities that are currently ongoing in Algeria, Bulgaria, Nicaragua, Romania, and Sri Lanka. And then you can see that they are at different levels. For example, in Sri Lanka, they are just, right now, they are focusing on improving the care of children with IMDs. And there's a UKRI grant that they have submitted and are waiting for its approval so that they can start with purchasing of the equipment. In Algeria, there is a joint multidisciplinary project between Oran Hospital, and they're also collaborating with France and waiting for a grant to start TSH and PKU screening. And again, in Bulgaria, also Ministry of Health is involved. In Nicaragua and Romania, face-to-face meetings were held, and so on. So there's a lot, that is ongoing, and the task force is supporting them to achieve, properly the newborn screening with follow-ups. Then we had this meeting where Kate invited the task force, and we supported in the program organization also as a side event with WHA 77 Health Assembly in May. And Kate has already mentioned it. We also participated in the newborn screening flyer, PARC IMDnet and PSCB. And we hope to take this forward in Pakistan on CAH. So these were the recommendations after these meetings, and we hope to be part of these implementation in Pakistan of these recommendations. Then after the 77th World Health Assembly resolution, WHO has initiated the development of a framework to support LMICs to commence or expand initiatives for newborn screening, diagnosis, and management into routine health systems. And the framework is intended to, again, facilitate discussion of considerations for selecting initial conditions. And the name that I have highlighted in in this list of authors for this report is Salima Valani, which is the Dean of School of Nursing at Aga Khan University. She also participated in this in a later meeting in Nepal, which was organized by Association of Asia Pacific Association of Human Genetics. And she has an interest in birth defects and is working, and we hope to work further in Pakistan with her as well. And then I just want to update this group about the World Map project, where ISNS is striving for excellence in neonatal, bringing data sources together into an interactive world map and to keep it up to date has been going on. This data set is established using publicly available data, and then there is paper which has been recently published last year in 2025 by Carmen Sita and Tharrell, where there's a whole of data available. So from this paper also, they are housing the information in this world map, and screening can be sorted based on 13 different parameters. And I encourage all of you to go through this map. This is a very useful information, and it is expected to help and support in newborn screening, as different aspects of newborn screening in several ways, and like for policy, for advocacy, or where the resources are more needed, etc., etc. So the other initiative that I would like to mention here is the International Development Co-Coordination Group, which is again an initiative of the International Society for Newborn Screening. And this is an informal group to share activities rather than organizing joint initiatives or joint projects. And as you can see in the table here, that almost all the organizations who are working in different aspects of newborn screening are included in this co-coordination group. And one of the objectives is to help avoid duplication of effort and provide some fresh insights about things that work and others that may not work. So making a consolidated effort and synergistic effort so that impact is better. Then I would just like to mention about this Newborn Screening Academy that has been, that will be offered as a one-day event before the European ISNS meeting in Luxembourg. And for those new to or with limited experience of biochemical newborn screening. And so people can join in there and so on. So that was the update on the task force activities from my side. And now I will move on to update you about the newborn screening activities and in Pakistan. And I start with this poster presentation, and because this was the inciting point for me to start working on bright blood spots specimen testing for CH at CAH University. And this was a meeting that I attended in 2016. And the lady that you see here is Dr. Farhanda Ghafoor. And I always mention her because she was very passionate. And her poster for establishing newborn screening program for CH in Lahore was made, was awarded first poster prize, and everyone was coming and cheering her up. And we also met her there. And and she was very passionate about her work and made, like as you can see in the poster, she had made everything, including the policy document. And the program was supposed to start in Lahore, but unfortunately, it couldn't be started. So this was the starting point, and I was attending that meeting, and I actually thought that maybe, that why I have not thought of bringing bright blood spot technology earlier, because we were doing screening for CH since 1985 with a serum test. And that's how the journey at AKU started. And it was in 2018 that we started a newborn screening program. And having gone through that phase, it was actually, we felt that there's a diversity of engagement is needed for advocacy. And where we started the very first conference on newborn screening in 2019 on the Rare Disease Day, to engaging hematologists, endocrinologists, metabolic physicians, pediatricians, where consensus on conditions to be screened for Pakistan was taken. And then there was launch of Pak IMD-Net for capacity building through education and training. And then again, we reconvened in 2020 after bridging this gap and lightening, engaging and educating. We reconvened in 2020 to reframe RARE in Pakistan for breaking silos and bringing synergies with the theme. And since then, a very comprehensive education agenda for healthcare professionals was made in combination with PSCP, PAC, IMD-Net, and Al-Khan University. And several workshops, relevant workshops, were conducted to, create the infrastructure resource when the newborn screening will be expanded, so that you need people, it's a team effort, and you need different people without which, you can't do without educating them. So satellite meetings were conducted. We talked about rare registry, newborn screening workshops, and then a program by the name of Rare Links was started, and connecting healthcare professionals across provinces. And since then, numerous CMEs seminars, Rare Link seminars have been organized. And there's a whole group across Pakistan who is now very well aware and participating in these activities. Then we felt that we are missing out on the patient, and there's a great need to educate and bring resources into one place. So this, we launched Ek Saath, meaning Ek Saath is in Urdu, meaning together, and Ek Saath with patients with inherited metabolic diseases, a portal where the objective is to bring all the resources in one place. And this was supported by a grant from SSIEM and there was an event for the patients was also conducted. So, and then we engaged medical students to voice against genetic disease. A mime show was organized to raise awareness on congenital adrenal hyperplasia, and this is available on XR portal as well, recorded and available. And then we also, through art, educating through art with puppet show on newborn screening, and this puppet show on newborn screening is also available on the XR portal. Then regarding advocacy, we also had a workshop with members from Sindh Assembly, policymakers for advocacy in 2021. However, the government changed and there is political instability, and the work was halted. However, there is again activity that has been initiated at at Sindh level. So, and we engage, and in this workshop, we engage all the stakeholders who were involved in newborn screening in some part of Pakistan, and they all made presentations there. Then, so there is again a lot of, comprehensive education for healthcare. We are holding book clubs, we are holding virtual courses, educational series, and connecting healthcare professionals across provinces. And these are some of the examples. And then a major advanced achievement is the launch of RARE registry. And this registry comprises of data from biochemical genetics laboratory, because in Pakistan, when we started, there was no lab, and patients' samples had to be outsourced, and there was a long delay. It was expensive, and this lab was formed in 2013. This is the first lab and the only lab so far. Another one is in Rawalpindi, which is doing this high-risk screening. So, and since then, since 2013, we have been able to produce the data that is needed to work. Again, this is not the updated slide, and the data that I'm showing here is of till June 2023, and where 37,811 patients were screened, and 6.6% were positive cases, and this is only with two techniques, amino acid chromatography and GCMS, and 50 disorders were identified. I have mentioned top 6 disorders: MMA, BTD, PKU, tyrosinemia, and CAHMSUD, PPA, and so PKU is also one, and BTD is the topmost disorder. And so the other thing that we are strategically moving in direction is addressing the medical education for biochemical genetics and newborn screening. And so far, what we have achieved, that we have integrated biochemical genetics and newborn screening in chemical pathology fellowship at College of Physicians and Surgeons, Pakistan. And now this has been approved. And the next step is to inculcate the teaching learning strategies. And then there's we have also integrated a course on biochemical genetics in MPhil program at our university, and this course is nowadays ongoing. And we are in the process of evolving a fellowship in biochemical genetics and the work is in progress. And currently, gap analysis of undergraduate medical education curriculum is ongoing. So I'm sure that once all of this is accomplished, we'll be able, and simultaneously with patient education and of course learning from what Irene has just mentioned, we'll be able to make an impact, hopefully. Then at the same time, we also developed this, because specimen collection and training and education, it was very important. So, and at AKU, we trained them trained the nurses. Now we have developed this VLE, virtual learning environment, for specimen collection and dried blood spot specimen for phlebotomist and for nursing. And this is the report that was published after creating the trainers. And now through this course and through simulation, we have trained more than 1,000 phlebotomists across AKU network in Pakistan. And as you can see in the map here, the red dots are the phlebotomy centers which are available across Pakistan in all the 4 provinces. And the major bulk of these centers is in Punjab and Sindh, and whereas it represents the entire country to have an access to diagnostic. And the network, so just a glimpse of this network, that Aga Khan University, with the center that you see is the main hub, Stadium Road campus, where we are based, and the biochemical genetics and newborn screening lab is based. And this is a tertiary care center. And then we have 4 secondary care hospitals. 3 of these are in Karachi, whereas 1 is in Hyderabad, which is another city. And so we started the newborn screening at Aga Khan University Stadium Road campus, first for CAH, and then we included CAH. And then once everything, the infrastructure and everyone was all settled, then we moved about a year back with 12 inherited metabolic disorders. And so the 12 IMDs are still, only screening is done for babies who are born at the tertiary care center. And whereas the program for CH and CAH is across secondary hospitals. So all babies who are born at secondary hospitals and tertiary centers are now screened for these disorders. And so we have AKH's Aga Khan Health Service presence in family health clinics. We have stat labs, medical centers, corporate clinics, and home health service. And we would, our next target is to move to Aga Khan Health Services, as these are the low-hanging areas where we have available resources. So this is the impact that I want to share with you, the newborn screening program at Aga Khan centers. So far,
we just have a couple of minutes left. Sorry, Dr. Aisha.
All right. Okay. So congenital hypothyroidism, CAH, and as you can see that the incidence is coming across. And for 12 IMDs, which is out of 6,186, it's 1:2, 2,778. And this is how that we are moving with CAH and using big data and AI for case findings and targeted interventions. And so far, we are using a cutoff of 7 nanograms per ml for 17-hydroxy progesterone. We are also planning a quality of life study with the medical students of AKU, second-year medical students, and we hope to develop a support group of medical students like the one at University of Leeds, or maybe using the same model at AKU. And then just very briefly, health systems in Pakistan, the policy context, we have legislations for Sindh, and there's a Federal Newborn Screening Act, which covers for Islamabad territory, but however, the other provinces, they do not have legislation, and this is the comparison of available two policies, which are currently for Islamabad and Sindh only. And there is, as you can see here, that there are gaps, and there are shortcomings. That policy either does not exist, and if exists, then they did not transform into effective implementation plans and evaluation mechanisms. And since private sector constitutes 70% in Pakistan as compared to public sector, so the policies does not address that how the private sector, which is a major provider for health services in Pakistan, and other stakeholders beyond healthcare would be involved in achieving newborn screening. So there's a lot that needs to be done, but that is a consensus that the incidence of CAH in Pakistan, the data is sufficient, the data is evolving, that this should be started at an earlier. So what we have proposed in a meeting in Peshawar in 2024, a national consortium for newborn screening should be made, and this should make the foundation for screening for other conditions, and then at the same time we are moving forward in next year of diagnosing, like for example for biotinidase deficiency, we did not have a confirmatory testing. Now this is a group is developing these pathways, in fact for hyperphenylalaninemia as well. So there are strategic advocacy initiatives that have been initiatives, and like establishing consortium, identifying and nurturing strong leaders, and what has been recommended that a group in PPA, Pakistan Pediatric Association, to work alongside PARC IMDnet and create provincial groups. And there's a lot of work that is going on, optimization and validation of assays, like we currently do not have carnitine, acyl carnitines, and other things which are confirmatory for some common disorders. And then we are also working to scale up. So I would stop here. And these are just to acknowledge the two ladies who have led PARC IMDnet with great passion. And obviously that this is teamwork with which we have been able to work and achieve so much. And over to you, Kate. I hope I have not taken much time.
Truly inspirational, Dr. Aisha, and we can see why you're leading the work in Pakistan. That's inspirational. Thank you so much. It was great to get that global view and then that national view. So thank you very much. On that note, we're very excited. Oh, I might just mute. Thank you. We're very excited now to hand to the team from the Solomon Islands. Dr. Nasi is on the line, and Dr. Shuba as well. They are. Might just ask people to mute if they're not speaking. So the team from the Solomon Islands, we're very proud that they're one of our round 2 grant recipients, and I'll hand it over to them now to share their updates as well. Over to you, Dr. Nasi from the Solomon Islands.
Thank you, Kate, and good afternoon, morning, to everyone. I don't have slides to share, so I'll probably just talk through the proposal and the project we are doing. Thank you for Mate Kids and Clan for the support. And I'm listening to Prof. Aisha, and I thought we are just starting where they were thinking about in 2016 or 17 or something like that. So yeah, so the background is for us to do screening for congenital hypothyroidism in Solomon Islands, and only at the National Referral Hospital in Honiara, which is the only referral hospital in the country of 750,000 population, scattered in 2 million square kilometers of water with only 28,000 square kilometers of land, scattered islands, 9 major islands, which includes the 9 provinces, and then we have a hospital on each of the provinces with other 300 in total health facilities scattered around the island. So logistically, it's very difficult to get to here and there. We use boats instead, very few airports. So it's most is done by canoe or boats on irregular schedules. So in 2020, we were doing a TPA, taking pediatrics abroad, and discussed with Dr. Shuba and Dr. Catherine about doing congenital hypothyroidism screening in Honiara at the National Referral Hospital. Since then, discussion went on, and early this year, we discussed the proposal to actually start the project, and thanks for the second line grant. The proposal has been submitted in October. Unfortunately, we only have one person running the Ethics and Review Committee, and they deliberated on the proposal, but she's still in the province with us having difficulty to reach her for the certificate to go ahead with the project. And that is required for the New South Wales newborn screening to be able to apply for the ethics approval before we could start. So that's where we are in terms of the proposal. Been discussing with Dr. Shuba and the team, and the discussion was to collect cord blood and send them over to Sydney. And I think TPA has done a work to fundraise for us and raise some money to be able to start to give us to get some reagent to do the newborn screening. So thank you so much for that, for the work in the cold. You guys went out of your way doing that for us. And on that note, our aim is to screen about 6,000 newborn deliveries at the National Referral Hospital each year for the next 3 years, and hopefully get a baseline of the data to see how much of incidence of congenital hyperthyroidism is within the catchment of the National Referral Hospital. We deliver about a third of the deliveries for the country. So in total, it's about 16,000 deliveries, and 5,000 to 6,000 are done here at the National Referral Hospital. So we hope it will sort of give us an overview of what it would be like for the population. There is no national health information system that could get us in terms of the database. The Ministry of Health with WHO support, they are discussing digital health at the moment, and also the referrals system. So I think it's a good opportunity to include this in the national health, whatever the system that comes up. So I've been in discussion with the ministry last 2 weeks. So we hope, I've asked them to sit down and discuss it, and I said, oh, can you wait until after January next year when we all come back to holiday, and then we'll look at what you want to include in the terms of the newborn malformation. Certainly hyperthyroid will be included inside. So there is some discussion with WHO and the Ministry of Health trying to set up a database as we are about to start. I think the only other thing that we've progressed is we managed to acquire the machines that we should be able to do thyroid functions when we are ready to start the project, which will probably allow us to do that. And we managed to get 2. So one of them we put in the molecular lab that they established for the COVID, and now the guys are doing very little. So hopefully when the things come through, we'll be able to get them to do our screening for the small ones when we are ready. So the plan is when the proposal gets through, we might do some bloods from some of the newborns so that we can have the machine have a qualitative analysis with the ones we have here and the New South Wales screening thing, so that we know we can use both in terms of screening and doing the project. I think that's probably where we are at the moment. I'm very excited to know that Prof. Khan has all the details about how to organize the system, and I hope to get in touch and we'll be able to see how and what you've done in Pakistan, and hopefully we can go about how to organize what we are thinking about here in terms of congenital hypothyroidism, and for the long term, hopefully we can be able to afford to do the newborn screening. So nothing is happening at the moment in terms of the systems, but I think that's our thinking going forward, and hoping, looking across the region, apart from Indonesia, Philippines, and Malaysia, the Eastern Western Pacific group are still behind in terms of collating newborn screening data to make us know what's the prevalence incidence in terms of the newborn gettings in the Pacific. So thank you so much, mates, and thank you, Clan, and thank you, TPA, and for the newborn screening team for making us part of the team and joining and learning from what you are doing in terms of newborn care screening. I think that's all from me, unless Dr. Suba have any addition. She's probably driving at the moment.
No, it's okay, Dr.
Thank
Titus,
you.
thank you very much. Yeah, for those who don't know me, I'm a pediatric endocrinologist in Sydney, Australia, and have been working with Taking Pediatrics Abroad and supporting the Western Pacific countries with their pediatric endocrinology. And it's through that connection that we're really keen to try and establish newborn screening, and starting off in the Solomon Islands. And yes, I too was very impressed and inspired by Professor Aisha Khan's work in Pakistan and the International Society of Newborn Screening. So hoping to work with them long term, but our initial plan is to just start with a pilot study for TSH screening with New South Wales newborn screening, doing the initial analysis and then building up the capacity locally to be able to develop newborn screening in Honiara locally long term. So yeah, nothing further to add to what Dr. Titus has already said. Thank you.
Thank you
I
both.
think just a last comment. So we are using this as a project for one of our MEd candidates through the University of Papua New Guinea Medical School. Dr. Zarina, but she's on leave at the moment. So yeah, hopefully next year she'll join the sessions as we go along. Thank you.
Congratulations, team. It's just wonderful what you're doing, and it's so important. And I know that you'll have the support of everybody as you progress with this project. So congratulations and thank you very much. And yeah, well done. Lovely. Now, we might just deviate from our agenda a bit, and I think my indicated chat can go at the end. I'd love to hand to the team from Sri Lanka now, if I can. We had 2 grants, 2 different centres in Sri Lanka, and they've done the most amazing work. They were part of our round 2. I'm getting confused all the time, but I think they were, round one recipients, I think. But Dr. Sumadu is going to speak for us first. So Dr. Sumadu, and I just acknowledge Dr. Navoda's on the line as well and has previously presented. But Dr. Sumadu, we'd love to hear from you and get an update on what's happening in Sri Lanka, please.
Thank you, Kate. So let me start by sharing my can you see the slides, please?
Yes, very clearly. Thank you.
Okay. So thank you very much for this opportunity to present some of the work we've been able to achieve thanks to the Mates for Kids grant. It was round 1, Kate, and it was granted to us in February 2024. Trying to move forward, yes. So and this was the motivation which led us to do the CAH Awareness Day in June 2024, and also translate a wonderful book written by the team in Indonesia, the book for young women with CAH, into the 2 local languages, Sinhala and Tamil. And we've also been able to disseminate some of the knowledge we acquired during these two events with the wider Sri Lankan population. So I belong to the Clinical Research Center for Complex Hormonal Disorders, which was established recently in 2022 with the aim of improving clinical care and psychosocial support for children and youth with rare endocrine disorders, and also to undertake research which would lead to improvement in patient outcomes and raise awareness among these rare diseases, about these rare diseases among medical as well as non-medical communities. This was very much in alignment with our center goals, and thanks to the grant from Meds for Kids, we set about to have a CAH awareness day for patients under our care at the Lady Ritchie Hospital for Children, Colombo. So I'd like to talk in three main phases about how we went about this: the planning phase, the implementation phase, and the outcomes. And hopefully it might inspire some of the new grant recipients also to conduct such programs, because we felt that it was a very positive experience for both us as well as the CAH community. So during the first phase, it was the first time that we were doing something, so we got a lot of ideas. We had several online meetings with Plan and Kate, and others helped us a lot. And most importantly, we also got ideas from our CAH community, our patients and their families. And taking their ideas and needs into account, we made a detailed agenda and set about getting the resources necessary to make this a reality. As Clan advised us that it would be good to get a psychosocial help on board, we were very honored to have Professor Priyanjali Disoisa, a professor in clinical psychology at the Colombo Medical Faculty, joining us right from the onset. And I think she's joined us online today as well. And with her support and with the families and some medical student volunteers, we held a preliminary meeting for about 10 families around Sri Lanka from different ethnic groups, mainly older children and teenagers who could share their ideas as well as their parents, and we discussed their needs. So these were the areas of concern which came up during that discussion. We felt that there was still a need for better education and support for many of these families. We found a gap in their knowledge about the use of the steroid alert card and stress dosing in emergencies, which we felt was very important to address. There were also, many of them were teenagers and older children, and they were worried about adulthood, living as adults with CAH, where they would have to move away from our center, and also how to face society as adults. They also brought up problems like lack of adult care services, specialized clinics for CAH. Some of them had learning difficulties due to late diagnosis, and therefore they had problems with being employed. When all of them were had access to the state government sector, where we provide free medication and biochemical monitoring, but during the economic and political crisis that Sri Lanka was undergoing from 2022, there was interruptions in these, which Plan helped us to alleviate, but there were still gaps sometimes, and also the financial burdens, which we could not address at that event, but which are ongoing problems which need to be looked at. But what we thought that we would do for the awareness day was really to improve knowledge among adolescents and youth with CAH and their families about how to live their future as healthy adults, and also to provide a platform for them to share their experiences and network with each other, because now they were older children, adolescents, and they could interact and share their own experiences. Secondary outcome was also to increase CAH awareness among key stakeholders and future medical professionals in Sri Lanka. With that aim, we invited the presidents of the Sri Lanka College of Pediatricians and Sri Lanka College of Endocrinologists to this event, and they graced us, and hopefully we will be able to collaborate more in the future. So we got the permission from the Dean of the Medical Faculty to hold this event free of charge at the newly established UCFM Tower in our faculty. So this is a beautiful venue. And the Dean, in his welcome speech, said that this is the first time that we have actually had patient awareness programs in this building. So hopefully that was a very inspiring remark for all of us. And we felt that it would also help increase the sense of belonging and community among these affected families. Also, the involvement of medical students was, I think, very uplifting because it helped them to be more sensitive and empower them how to hold such similar events as future healthcare providers. But we did meet many challenges across the way. As I told you, there was political instability. Things are much better now, but we had a lot of instability and trade union action. So the non-academic staff of the university were on strike for the whole of the duration where we were planning and implementing this. We also did not have any other financial support except for the grant from Plan. But this and all the support of, I think we had a lot of human resources, and that was really the motivation behind this. So Kate and the team really motivated us, encouraged us. We got a wonderful medical care team and medical student volunteers. The family's enthusiasm all helped. Getting a free venue was very helpful, and we also were able to get a donation from a well-wisher for refreshments for all the participants on the day. This is a picture of all the medical students who volunteered their time, because they also had a gap in their academic lectures because of the strike, and they spent many hours with us. They helped us to prepare educational videos, illustrated. We had an education leaflet for our patients in the local languages, but it was not very user-friendly, so they illustrated it very beautifully. I'll share images. They also helped with the registration, ushering, comparing, decorations, entertainment, photography, all the beautiful photographs that I'm sharing today, and also made a wonderful little videos out of all the events that we had, which we are now able to disseminate widely. These are pictures of the healthcare team who were behind me every step of the way, helping in planning, implementation, preparing the educational content. In Sri Lanka, many of the families who attended the event were unable to, I think, understand content in English. So we did the entire program in the 2 local languages. That was a bit challenging because many of us are not bilingual. So our team luckily was multicultural, and we were able to help each other. This is a picture of Dr. Dimuthu Muthukuda, the adult endocrinologist, who is helping us set up a transitional care service for our children with CAH, and Professor Priyanjali Disoisa, Professor in clinical psychology, who helped us greatly with all the events that we did. One of the key highlights that I'd like to talk about and hopefully inspire other people to take up was the translation of the book for young people with CAH, which was written by Dr. Augustine Utari and her colleagues from Indonesia and shared at a previous CoP meeting, which is when I got to know about it. And with permission from them and CLAN, as part of this grant proposal, we translated this book to both the local languages which are used in Sri Lanka, which is Sinhala and Tamil. And Prof. Priyanjali and I helped them to do cross-cultural adaptation to make sure that the terminology and even the images were appropriate for girls in Sri Lanka. We did some modifications with the help of the medical students, and these were launched as ebooks with ISBN numbers at the CAH Awareness Day and disseminated via our WhatsApp groups with the pediatric and endocrine colleagues to share with their patients who may benefit from this book. So these are the 2 books in Sinhala and Tamil, and the 2 MBBS graduates, Dr. Dulani and Dr. Afra, who helped us with our translations. And this is the CAH leaflet, which we already had at our center in Sinhala and Tamil, but the medical students really made it very beautiful, illustrating and adding color. And these were also made into e-leaflets, which could be shared online. And with this, we went ahead with the CAH Awareness Day. And this is a brief look at the agenda. So Kate made a beautiful video, which then the students added subtitles in Sinhala and Tamil, and which was shared, which was very welcoming to the participants. We had educational programs on what CAH is, about what the importance of the hormones and what they do. This was by the medical students, a lovely video presentation. And our two senior registrars spoke about sick day management in CAH in both local languages. We had some wonderful speeches by young people with CAH and a parent. We also had some educational programs and two wonderful speeches by adult endocrinologists on facing adulthood with CAH and Prof. Pianjali on the psychosocial aspects of living with CAH. We had a sing-along and took some photographs, and it was and ended up with lunch. So the preparation, as I told you, we had a minimal budget, but the students did all this with no funding, and even the video recording was done by a small phone, and so it was at no cost, but I think we got a wonderful output at the end. This is a cross-section of the patients, the families who visited, and you can see them even before and after the event, collaborating and talking with each other and catching up. So that was very heartwarming. And this is a video by Kate, and this is a picture of the Dean of the Faculty of Medicine who welcomed the participants, and it was great to have this permission to hold this event even at a time of trade inaction in this venue. The first picture shows the two medical students who spent many hours preparing a beautiful video using a lot of illustrations, how to educate the parents on the pathogenesis of CAH, what is actually happening and what hormones are missing. We spent many hours together, and it was a good learning opportunity for them also to how to get rid of medical jargon and do it in a simple, meaningful way. Our two senior registrars did a wonderful lecture on steroid dosing and the steroid alert card. This had a profound impact on one of our patients, which I'll talk to you a little bit at the end. And these are pictures of Samira, a wonderful 23-year-old university student. Unfortunately, she's having lectures today, but we really wanted her to share her experiences today. But she shared a short video, which Kate will be sharing with you shortly. And this is a father of one of our 17-year-old boy who is now sitting for his A-levels nowadays. And it's amazing, though it was 17 years back, how this father could recall every event associated with the diagnosis of his child with adrenal crisis, and what kind of shock it was to him, and how the medical team rallied around. But he was very, I think, grateful for all the medical free support that Sri Lanka offers for the community. We got a beautiful slide team. We wanted to share the authors of the original book, and we shared a QR code to download the ebook at this event. And this is for teenage girls with CAH, about many aspects which are not easy to address, and a wonderful resource which is now available in Sinhala and Tamil. Dr. Dimuthu Muthukuda talked about the changes which happen during adulthood, and that the focus must now be on fertility and metabolic outcomes. And Prof. Pianjali spoke a lot about how to successfully face challenges and live a happy life with CAH. We also had some beautiful songs sung by a medical student. The songs were also chosen with care so that they were on themes of healing power of nature and how we should help each other and live together as a community. And we made sure that they contain verses in both the local languages, so no one felt left out. And we all had a sing-along at the end. And this the middle lower row picture shows Mr. Rugit, who's a 17-year-old boy who also voluntarily joined in and sang with our medical student. This is Dr. Dulani Seneviratne, a wonderful young doctor who spent four months coordinating the whole project and did an amazing job. She's also started an internship, so she's not with us here today. We had a little discussion at the end. And This is Rugit, and I'd like to share a short story about Rugit. Again, I wish he could be here today, but he's sitting for his university entrance exams today. So a few weeks after the CAH program, he had an unfortunate event. He plays rugger in his school team, and he had a head-on collision at the rugger field and concussion and been unconscious. He did not have his steroid card with him because he was on the sports field and had been rushed to the general hospital, the adult care hospital. And no one had known he had CAH. But the mother said that the moment they called and told her, she had a picture of the CAH card in her phone, and she immediately shared it with the attending doctor. And it is at that point that they administered IV hydrocortisone. He had been unconscious until that point and regained consciousness shortly afterwards. So I think this inspires all of us. Sometimes a small step can go a large way, and we are very happy that he is well and sitting for his university exams today. And a little bit more about the broader outcomes. So we got feedback from all our participants regarding the event, and many of them expressed their gratitude. This is the first time that they had the opportunity to attend such an event, and they said they gained a lot of new information and would like to attend similar events in the future. Dulani helped prepare a beautiful 20-page report to be shared. I think CLAN will be sharing it on their website, detailing the planning and implementation of the CAH Awareness Day. We hope it might help other countries who want to do something of a similar nature. The CAH teenage books in Sinhala and Tamil have been shared by the WHO CAP site by CLAN. And we've also created a website for our center where we have now shared the instruction leaflets and the books on our website, which can be shared by anyone, accessed by anyone throughout the world. The medical students also helped us to make short video clips. So we have these in Sinhala and Tamil on introduction to CAH, sick day management, the talks by Samira on living with CAH, adulthood with CAH, psychological aspects of living with CAH. All these are available in the 2 local languages on our website. And I'd really like to thank Kate and CLAN and Mates for Kids for inspiring us and providing us with the grant to help us achieve all this. And it's been an inspiring occasion, and I hope that some of these resources will continue to serve the CAH community for many years to come. Thank you very much. And I'd like to stop with some words by Samira, who said during a very inspiring speech that when people around us understand and support us, it becomes easier to live with this condition. So increasing awareness hopefully will help. And I think we have a beautiful video, which we'll listen to now from Samira herself. Thank you very much.
Thank you so much, Dr. Simadou, for that really inspirational presentation. I will open up the video and I hope it will work. So this is Samira's video message. Let's see. Can everyone see that okay? I'll just see.
Yes.
Saying that screen share before.
Hello everyone, my name is Tashan Samira Karatna and I'm 23 years old. I'm currently a university student, a second year student of the Faculty of Applied Sciences, University of Sri Lanka. I was born with Congenital Adrenal Hyperplasia or CAH, a condition that has been part of my life since birth. Interestingly, my elder sister was born completely healthy, which makes my journey even more unique within my family. Today, I'm truly honored to be a part of this CAH Awareness Day event and to have the opportunity to share my story. First and foremost, I would like to express my heartfelt gratitude to Dr. Simadou for giving me this chance to speak. It means so much to me to be part of a community that understands and supports each other in navigating the challenges of living with CAH. Being a part of the CAH group has been an incredible experience. Over the years, I have learned so much, not just about the condition itself, but also about the strength and resilience of individuals who share similar stories. Every one of us in this group has a unique journey, and while we face challenges in various ways, we also show immense courage in overcoming them. This sense of shared experience and mutual support has been a tremendous source of inspiration for me. It reminds me that I am not alone and that we all have the strength to rise above obstacles. Events like this CAH Awareness Day are inavailable for many reasons. They are not only help raise awareness but about the condition, but also create the space for individuals like me to reflect on our journeys and feels more connected. Personally, this program has helped me better understand my own condition, improving both my physical and mental well-being. So it has given me clarity and strengthened my confidence to face life with a positive outlook. I hope that through this webinar and other awareness efforts, more people will come to understand CAH and the importance of supporting those who live with it. Let us continue to share our stories, learn from one another, and inspire others to embrace their unique challenges with strength and determination. Thank you all for being part of this journey with me. Together we are stronger. Thank you again, Dr. Sumudu, and the entire CAH community for making this event positive. Stay strong and take care.
Well,
Welcome to the show. Feel the love. Feel the love. Thank you for being here.
that led into
Excellent work.
But congratulations, Dr. Sumudu. And there is a future leader of the international CAH community. So truly inspirational. Thank you, thank you, thank you. And I also acknowledge Dr. Navoda's on the line there as well and did amazing work as well in Sri Lanka. Such a powerhouse, and I do feel the face of CAH in Sri Lanka has changed forever. So congratulations very much.
Thank you.
Okay. So we're very honoured to have another round two grant recipient, Dr. Esther Coble, on the line, but I won't put her on the spot and ask her to speak, but it's wonderful that she's joined. She's a member of the Clan Child Health Africa team. But I did want to, we have two other things left on our agenda. We want to announce the grant recipients for round 4. But before we do that, we do have the team from the Philippines here. I see Ellie there. And Ellie, would you like to give us a brief update on what's being planned and discussed for the Philippines? Because it really is truly exciting and we'd love to hear about it. Thanks, Ellie.
Kia ora, everyone. I just want to extend my apologies for joining this meeting late. I had some issues with the timing first, and the second was just, but you know how life is. So yeah, I'm a pharmacist from Colombia. I have a condition called partial androgen insensitivity syndrome, which is framed within conventionally into the model of DSD. And so I do have a connection with the issue from that end, but from the other end, my mom is a pediatrician. So it's a double situation in which I see like mirrors of a particular way of understanding this, both what being intersex is, because it's a complicated term, but on the other end, also how we offer help to our communities. And we are committed to identify ways and to ensure improving the access to fludrocortisone, hydrocortisone, 17-OHP, expedite and facilitate and ensure that MBS is done across the Philippines. But I think more importantly right now, what we want to devote our love and attention is to make sure that we have emergency kits available to every single family, because just anecdotal experience is telling us that that our babies are dying, right? I'm aware of 2 recent deaths. I'm also aware of parents having to go to hospital, almost begging for help, and then they get completely denied the services because they don't have anyone that understands how to treat the CAH, and they don't understand what is triple dosing, or and they don't even, they will only give you hydrocortisone injectable if you are in a hospital setting, right? But what happens if you are in the Visayas or in Mindanao? And so that's why we are hoping that we can devote our energy and time to find a solution, including Pfizer, for instance, with Solucortev, but how to make that a reality, not just in the Philippines, but in Asia, right? So that's why we want this project in the Philippines to work, because Dr. Kate has been doing this work for nearly 20 more years, 20, 30, 40, so nearly 20 years. And because of it, I recognize that this is a try and error that keeps going, and it's like a repeat and repeat and repeat. So I want to add more fire to this problem by identifying in the private sector how we can make this problem not to be a problem, because we're talking about a small number of kids that actually will be eventually needed, but we're talking about human lives. We're talking about persons that at some point in their lives will get married, or will be scientists, or will be making the world a better place for all of us, right? So I think that's our attention. That's how we hope to align with CLAN. We are not here hoping to define what intersex is or not, because that's totally unnecessary. We are here to identify access to medicines, and access to affirmative healthcare for intersex people is very simple, right? I mean, it may be more complicated in the eyes of someone else, but we just see it that way. We are tired of these babies just dying. That's sick. It's sickening to hear. And we want to make this important work, because regardless of how a person might identify, either male, female, people that are born with different sex characteristics have a very unique, challenging experience, and our CAH communities need to be aware of that, because the medical model may have to be updated, because some bodies are different and they don't need to. But the thing is that what we want to is that we allow life to be and manifest. And that's why most of you here are doctors or health professionals, of all of us, because that's what we want. We want to be able to extend life, and extending life meaning love, like share that love. And I think that that's what I hope we can do. And if someone here has worked on similar projects with Solucortev or has contacts, I'm also contacting colleagues in Colombia from Vesalius Pharmaceuticals. They may be able to help us. I have to reply their email, but because I'm trying to first identify what will be the best, cost effective and all of that, but at the same time identifying sources of funding. It's not easy just when we are somehow just kind of finding the ground in this space. But I think that even if we get donations, we can provide with a coordination or logistical way of making that happen. And that's why I'm very glad that CAHPePTalk is a tool that is there. It can teach us how to use it, how to inject, and basics that are not necessarily so basic, and that many parents won't know easily. So you have to be there constantly with the communities, telling them, look, you have to do this way. This is how when you have an adrenal crisis, and so on and so forth. So it's been interesting, and I think that's all I want to say for today. I just want to extend, the work that I do. So if someone wants to maybe give me ideas, or can help each other, or learn about how to make this even more, scale it up, we can identify ways to work together. And I can share my email in the chat box in case someone maybe would like to keep a connection. And yeah, I think that would be what I wanted to share. Thank you so much, everyone.
Thank you so much, Ellie. And Irene, her email address is in the chat there, although you might have come in late. So Irene, I might just get you to copy it in again. But I think Irene has had a lot of experience in this space. So yes, and a lovely offer there from Riziki to help with translations as well. Riziki is based in Kenya. Fantastic. Thank you, Ellie. Well, we please keep us updated on that project to make hydrocortisone injections available for all families so that they, at least, even if they don't have a kid at home, they know where to get one within 30 minutes or an hour of their home. That's just so important. So thank you. And the Philippines has such an inspirational newborn screening program. There's an opportunity there that every child diagnosed through newborn screening goes home with a kit and instructions. So we really are very grateful for your work on that. This brings us to the final part of our session today, and I really can't thank everyone enough. It's just been an inspirational session. I'm just going, oh, that's just, I'll just undo that. Just putting that there and that there. I was just going to speak very briefly before we finish about indicators that we're going to use. I mentioned we're going to be using indicators to track our progress. And I'll speak a little bit about this now, just very briefly. So how are we going to track our progress as a collective internationally, our progress towards 2030? And we have been co-designing with some of the grant recipients and other partners that we work with 6 tools that will help us collect the indicators and the data that we're going to need to demonstrate how we're progressing. The first one is called a snapshot survey. This is just a very quick 15-minute online SurveyMonkey survey that is usually completed by pediatricians, pediatric endocrinologists in a country, noting not every country has pediatric endocrinologists, to comment on the overall, to get a picture of the overall status of pediatric endocrinology in a country. So it focuses on 4 conditions, 4 childhood NCDs, type 1 diabetes, CAH, hypothyroidism, and osteogenesis imperfecta. And we found countries use the results of this to identify priorities for action. The second one, I might just check if people go on Zoom, on mute, sorry. I'll just put that on mute. So the second indicator there is a quantitative measure. It's a score out of 30 points, and it can give you an idea of how your country is tracking compared to other countries. And it has about 20 questions, and you get a score for each question, and then you end up with a score out of 30. So Australia, for example, has a score of 26 out of 30. A high score indicates there are strong systems and structures to support the CAH community. A low score, we had one country in Africa who had a score of 12, for example, which suggests that there are going to be some challenges for communities and families. The next one is a health needs assessment, and Dr. Sumadou spoke about how they did a consultation with the CAH community. Colombia's recently done one, a detailed survey consultation with the community to understand their challenges from their perspective. The Czech scorecard, Dr. Navoda from Sri Lanka has previously presented on their use of this. This is where every child with CAH is given a score out of 10 based on some indicators relating to the social, cultural, and economic determinants of health to identify children who are at most at risk. And Colombia in particular has now been implementing this with their whole CAH community. It's helped them identify 7 children with special needs, and they've been able to put some wraparound supports around those 7 children to help support them. The next one is a traffic light. This is a visual display of how your country's progressing with progress to improve quality of life and health outcomes and reduce mortality for the CAH community. And finally, the CHESS newborn screening checklist. This looks at the 6 WHO building blocks and gives a score out of 48 to reflect how your country's newborn screening program is really supporting people living with CAH. So just in terms of next steps, we'll be working with grant recipients to further co-design and refine these indicators, and we'll be helping report back at these community of practice meetings on how countries are going. But this really leads us to the exciting part of the meeting, where we really want to acknowledge the recipients of our grant, of our round four grants, the Mates for Kids grant. So we've heard some inspirational presentations today from Sri Lanka, the Solomon Islands, and so forth. And we're very thrilled to announce that we've just awarded 2 grants to Indonesia. One will be going to CAHPePTalk, the CAH Community of Indonesia, and they'll be using that for some community education and strengthening. And another to some health professionals in Indonesia, who are really going to be focused on supporting health professionals and communities with education and training and information around CAH, particularly aligned with the brilliant work they're doing with newborn screening for CAH in Indonesia now. We're thrilled also to be awarding a grant to the CAH community of Zimbabwe. They will be they're specifically focusing on the community there, decided that surgery was an urgent issue for their community, and they're looking at ways that they can support the community with more information and understanding around surgery, but also emergency injections and the importance of those for surgery and medical procedures and during times of stress. So we congratulate the CAH community of Zimbabwe. And last but not least, the Magic Foundation in Kenya will be working with the Pediatric Endocrinology Society in Kenya and also the CAH community in Kenya to really increase awareness about that. And we're really honoured to have Riziki from Magic Foundation in Kenya on the line with us today. Riziki, I don't mean to put you on the spot, and you don't need to give a formal presentation at all, but congratulations on this grant. And I just wondered, are there any words that you'd like to say, or would you like to share any information about your plans? And I'd also like to thank Dr. Esther Coble and Dr. Andrew Twinamatsiko from Uganda, from Clan Child Health, who've very kindly offered to support Riziki. Riziki, are you there at all?
Yes, I'm here. Hello, everyone. I understand it's a morning, it's afternoon and evening. Yes, I want to thank everyone, Made for Kids, the clan organization, both in Africa, Dr. Esther and Andrew. They have been very helpful and resourceful with the information and the guidance that I needed, especially for the CAH. Because we also deal with other groups, but among them also is CAH Community, and we're hoping to create more awareness to the public and to everyone regarding the CAH condition and awareness. And I'm looking forward to do more of that by working also with our doctors, the PES, which is the Pediatric Endocrine Society of Kenya. And we hope to be heard, and we hope to make a difference in our country, especially also with the newborn screening, which is lacking in every hospital, because we only have like 3 hospitals which are doing the neonatal screening. So thank you so much, Kate, for this amazing opportunity. I'm truly honored. And yeah, we hope to make a difference, not only in Kenya, but also in Africa. So thank you so much.
It's truly an honor, Riziki, and congratulations, and thank you for working with the Clan Child Health Africa team, but also with PESC. We really believe in the work that you're doing and the changes that you'll make. So look, that brings us to the end of our program. It's just been inspirational hearing from everybody. We've put lots of links and follow-ups in the chat. We will be sharing a video recording of this meeting with you all and with the broader Mates for Kids network. So we thank you for sharing. We'll include some of the resources and links that were mentioned in this meeting as well with those minutes. But thank you. And thank you, Deepa. Any messages from India there? Lovely to have you on the line.
Hi, Kate. It's good to meet you. I saw the email from Marika so late that I'm not quite presentable, but I really like listening to everybody and hope that we can share what is happening with India at some point in time.
Oh, we would welcome that so much. We'll put you on the next agenda for the EMR, SEAR, WPR, a part of the world. Our next community of practice meeting in March will be going up to the Northern Hemisphere. So we'll be hearing from Africa, the Americas and Europe. But Deepa, we will put you on our list for the next community of practice for this part of the world. So thank you very much, everybody. It's been a real honor hearing your stories, and we look forward to connecting with you again soon. Have a wonderful holiday season, and lots to do in 2025 and for the next 5 years. But we will have a lot of celebrations and things to celebrate in 2030. I predict we will have a big conference, a big party in 2030 to celebrate our collective efforts. So thank you, everyone, and have a lovely week, and we will see you next time.
Thank you, Kate.
Thanks, everyone.
Thank you.
Bye.
You.
Thanks, Dr.
Bye.
Everyone.
Thanks, Kate.
Bye.
Bye.
Thanks to
Bye.
everyone.